Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Yep, I'm actually a patient posing as a radio guy. Listen, the reason I love doing these shows with Dr. Julep and some of the other things that I do, some of these, long-form shows, is because I honestly really believe in the people, the practitioners that do this stuff. And in particular, because not only do I relate a little bit to this, but I also know people ask me so many questions. And I don't know, no matter what website you go to anymore, there's always an FAQ. If you go to the Spectrum website, doesn't matter where you go, it's FAQ, frequently asked questions. And, I think that I know this for a fact, in my regular talk radio shows, and this should come as a surprise to some, there is less than 0.1% that will actually call a radio station to be part of a conversation. That's just the way it is. And it's been like that forever. That's why sometimes on some shows you hear many callers over and over again. Every day they have a new question. I think questions are what drive our businesses. And I would think that a good dose of these frequently asked questions, for those of you that are listening for the first time to our show, Vein Clinics of Hawaii has got a lot of things going on. I'm going to drive you to the website a lot. But I think that Dr. Julep has actually sort of compiled what rings people's bell, what people makes things, I got to go see a Venus guy, or I got to get my legs checked out. And so first of all, you think that it's all about varicose veins. Well, is it? Well, maybe it is. But we need to identify and categorize and list everything. So the number one frequently asked question is, what are varicose veins?
Yes.
Is that fair? I mean, look, you've been doing venous surgery for decades, and so it is the number one.
It definitely is the thing. Varicose veins are the thing that most people recognize as have. If they have that, they can easily say to themselves, "I have a vein problem."
Okay, how about people that see a surface vein, these little veins, spider veins? Mm-hmm. Oh my goodness, I got vein issues. I got vein problems. Do they?
They may or may not.
Yeah, that's interesting.
With spider veins, you don't know, and we do evaluate those people. Some people don't have underlying vein disease. They just have sporadic spider veins, and typically those people are coming in for cosmetic reasons, and we treat it. But varicose veins, in general, when people have that, invariably they have an underlying problem with their vein function. Yeah. And it's a little confusing because, again, a lot of people know the name varicose veins, and varicose veins has almost become synonymous with the bigger problem, which is something that we call venous insufficiency.
Gotcha. Yeah, but varicose veins, the term has been forever, right?
Oh, yeah.
And people are saying venous insufficiency. Yeah, varicose veins.
Right. Yeah. And even it's interesting because even some of the insurance companies, they refer to the broader topic of venous insufficiency as varicose veins. So it gets a little frustrating.
I would think if they realign their thinking and talked about insufficiency, that would mean you have to get it sufficient. That would say, okay, treat this person, because if they are insufficient, we don't want that to be a springboard for other conditions.
Right. Yeah, and like I said, invariably, if somebody has varicose veins, then they are going to have they are going to be insufficient of the vein function of the veins that are deeper in the leg. So that's what we mean by venous insufficiency. The veins that are deeper in the leg, not the ones that you see superficially, not the varicose veins, although those are abnormal veins, not the spider veins, but they're the deeper veins in the leg that have lost their normal function, and that's the problem that's causing the symptoms in the patient. Varicose veins, of which is only one of them.
Are some people surprised at the size of the legs the size of the veins that are way inside? Because I take a look at a varicose vein in my leg, and I think, wow, that thing is huge. But what you say is that's not huge. That's a little one.
Yeah.
The big ones, if you have a problem with a big one, you have a real problem.
Oh yeah. The veins that are deeper in the leg are much better or much bigger than any varicose vein that you would see superficially. Yeah, and some people can have problems with them. Luckily, the majority of people that come to the office with vein issues, their deepest veins, the very big ones, are working normally, and that makes our job a lot easier.
I should say, and maybe repairing some of the peripheral stuff that we can talk about. But I also think that people become, I don't want to say a glutton for punishment with these questions, but they actually become more and more inquisitive, trying to say, well, is that me or is that not me? There's one term that I had never heard before, very recently, and that is pelvic congestion syndrome. And I'm thinking, okay, before we get to that, let's talk about where these varicose veins are more likely to happen, because you said that it's pretty much in the legs, the lower part of the body. There's a reason for that.
Yeah. Which is the fact that I think you have to start with a question even before that.
Okay.
What causes varicose veins?
Yeah.
And again, it's this process of venous insufficiency. But what is venous insufficiency? Well, venous insufficiency is the deeper veins in the legs aren't working properly. And like we've talked about a lot on this show, veins are the blood vessels that carry blood back to the heart. So in our legs, the blood flow in the veins should be consistently moving upward. And the way that happens is because of the fact that there are tiny little one-way valves in the veins that keep the blood moving up. Blood through arteries, on the other hand, moves because the heart's pumping.
Yeah, and gravity takes over with that pump, right?
To some extent. But the primary reason why blood moves through arteries is because the heart's pumping and the blood goes to the all parts of the body. Now,
but for the blood to pump, wait a minute. That heart is pumping out this blood, but the veins have got to bring back blood to keep that pump going.
Absolutely.
Yeah.
Absolutely.
Yeah, so that's what we're talking about.
So
here, really.
So the road back, which is through the veins, is not the blood flow is not happening because the heart is pumping. It has lost all that pressure already. So the veins rely on our leg muscles. That's the muscle that it depends on, but also to a great extent. The capacity of these small one-way valves to keep the blood moving up. Now, when in venous insufficiency, that's what happens. Those one-way valves fail.
Very, very interesting, and that's why I wanted to. So when we talk about it, you said that it's not impossible to have vein issues above the waist, but it's not anywhere near as likely. In other words, probably a minimal amount of that, right? Yeah.
Well, a lot of people come into the office and they have varicose veins in their legs, and we talk about that, why it has happened, what we should do about it, etc. And a lot of people will then point at their arms.
Yeah, I do that.
And a lot of people will have fairly prominent veins in their arms, and they'll say, "Well, hey doc, what about these veins?
Yeah, are they varicose? Yeah.
And the answer to that is no, probably not, because the same physiology is not happening at the level of of arms as it is at the legs.
Do you find it interesting? This isn't on the frequently asked questions; it's one of mine. Do you find it interesting that a lot of people in the bodybuilding, they take advantage of that? As a matter of fact, I don't know if it's a show of strength or whatever it is, but you see this big Arnold Schwarzenegger type dude with these veins that are literally bouncing off their legs and chest. It's like, whoa. Isn't that a little too close to the surface? I mean, what happens if one of those things gets cut?
Getting nicked, yeah. I think, well, why does that happen? To begin with. But, that happens in people like Arnold Schwarzenegger because they have no body fat.
Yeah. Of course. Yeah, no fat. Listen, they used to have a hard time finding a vein for me, because, when
you have the opposite problem.
Yeah, exactly. So that's really a great point. So that's why maybe you see a lot of people maybe that are really thin that have these more visible veins.
Yes, absolutely. And that's who we see, real prominent veins in the arms are typically very thin people, and they don't have any subcutaneous fat. So the valves fail. and the blood in the deeper veins in the legs start to go in the wrong direction. They go down, and that creates increased pressure in the venous system as a whole.
Okay.
And varicose veins are just branches off of those deeper veins that are failing. So the varicose veins are were previously just little branches. However, with this new increased pressure that they're seeing because of the reversal of flow, they're getting bigger and bigger with time.
I was going to say, it looks like if blood that's trying to go up can't, and it gets stopped somewhere,
right?
It becomes they get bigger,
sure.
and the conduit through that vein gets smaller,
right?
Okay, now. So that sort of answers part of the question, because we talked about this as being way more prevalent below the waist, but in the lower part of the body.
Yeah.
Therefore, my pelvic congestion syndrome, which I have really no clue what it is, what is it?
Well, you wouldn't have pelvic congestion syndrome.
Okay.
It's typically
I was going to say, is that a female condition?
It is, yeah. And it goes to the question of, can you get varicose veins in other parts of the body? In that location, you can. Now, we're talking about the venous system of the pelvic organs. Our arms, our extremities, have artery and artery flow, blood flow, or venous flow. But the internal organs have that same sort of process. Arteries are taking blood to that organ. Veins are bringing it back. Well, in the process of pelvic congestion syndrome, the veins that are associated with the pelvic organs, uterus, ovaries, tubes, etc., those veins can also actually become incompetent. For the same reason, there are tiny little valves in those veins, one-way valves that keep the blood moving up. Those valves can fail. Now, they fail typically for a little different set of reasons. Versus the failure of veins in the legs. We can talk about that some other time, but still the result is the same. The blood starts to go in the wrong direction. The pressure increases, and those veins become enlarged and varicose.
Is that sometimes maybe because of the change in the physics of the woman? I mean, when you're pregnant, you gain a lot of weight, get a lot of fluid, and now you got this anywhere from 10 to 50 pound thing in you. Does that maybe pinch off circulation and hurt you that way?
Very much so. Yeah, not only the change in the anatomy that happens during pregnancy, but also the change in hormonal milieu of your body.
I tell you, I want to thank mommies out there a lot, because I'm thinking those that went through it more than once, they are heroes, right?
Oh, yeah.
We'll never relate to that.
No. In this process, pelvic congestion syndrome actually increases with women who have multiple births. The more births they have, the more risk they are at developing this.
Is there any line of questioning that would address that? It seems like a lot of times now, particularly in our country, that families are starting later. I mean, it used to be, you get out of college and you have babies. And now, for any number of reasons, the millennials and newbies, they want to just get established in a career, or buy a house, or go to spend a month backpacking in Europe. And so they're having babies earlier. Later. Does this add problems to circulation?
I wouldn't say specifically, but the female body is the female body with respect to pregnancy. It's like anything else. I mean, it's going to tolerate it better at a younger age.
It's pretty neat, though. You got to admit, it's pretty neat nowadays that medicine can actually help women in many respects that wanted that to have a baby when they're 35 or even older in some cases.
Sure,
it's kind of neat. Okay. So that explains it. The pelvic congestion syndrome is not going to be my problem.
It will not be.
Okay.
There are other things that might be your problem.
Oh, yeah, and that's what we want to talk about. The things. The next question on our FAQ list is, who is at risk for varicose veins? Is it gender specific? Is it ethnic? Is it all of these things? Is it because your parents had it? What are some of the reasons?
Probably the foremost reason is genetics. If your parents had it, and your grandparents had it, then you've got a very high likelihood of having it. As a matter of fact, if you have one parent that has had venous disease in the past, the risk is about 50-60% that you'll have it. So more than just 50-50. if both of your parents have had venous problems,
make your ultrasound appointment today.
Please,
Basically, you're going to have it. Yeah.
Come in immediately. Because it's about 90% that you will the children will have some amount of venous insufficiency at some point in their life.
Yeah, and gang, don't feel, oh, woe is me, because it's like everybody. And in previous programs, I know you've heard this, and you're going to hear this over and over as Dr. Juleff and I go through this stuff, is that we live longer. And this disease takes a long time to manifest in many, many cases. But knowing what your probability is, the earlier the better. Mm-hmm. Because of, if you have a symptom, you get diagnosed early enough, you can probably march on a treatment program that is going to really delay more of that problem.
Yeah. And that
I'm hoping.
That gets back to the symptoms and people recognizing symptoms. If people are aware of the fact that their genetics are such that they are at a higher risk of developing venous insufficiency, then they will probably recognize and pay a little more attention to the potential symptoms. You know, we've talked about in the past that the symptoms of venous insufficiency, they come on over a very long period of time and they come on very slowly. And so sometimes it takes, people 20 years to recognize that, gee, there is something abnormal going on in my legs. Well, those people, had they recognized that their genetics were optimal for developing venous insufficiency, then they probably will come in and be evaluated at a younger age.
Very, very interesting. And one of the things that I came to learn since we started doing our show, and by the way, all these things, you can find examples and more frequently asked questions, and more importantly, some of the procedures you can do at Vein Clinics of Hawaii. It's very, very, very safe surgery. It's in, most of the time it's right in office. You walk in, you walk out because of the modern ways to do it. I want to go back to when your mom or your dad had it. In my case, both parents, but my mom much worse. It was just, I guess, a part of the business that she was in, standing up in a model and standing up in the retail business. But I think that a lot of people today, Dr. Juleff, are hesitant to get treatment because they remember what their parents went through and it was not pleasant. Mm-hmm. So they just think, you know what, I don't want treatment, I want a pill.
Yeah. Well, that's true because, most lay people don't know, where the current science is. And, the technology that we have today is so much better than what their parents had, 20, 30 years ago.
It changes almost at the speed of light, doesn't it?
Yeah. And it's just so much more pleasant getting treated. I mean, I can remember very early in my training doing what we used to do, which was surgical vein stripping. Nobody liked it. I mean, the patient didn't like it. The doctors that were performing the procedures really didn't like it all that much because they knew that it was not a very optimal procedure.
Let's say that you have an inkling that something's going on. But you haven't had, you did some walking. You did the internet check and you looked for symptoms. Yeah, well, it doesn't look so good, but I don't have any of these symptoms. And then all of a sudden, if symptoms do, are there telltale signs that, wait a minute, this is way past thinking you have something, you need to be examined? What are some of the things when they pile up to get people to the point where they pick up the phone or they go to veinclinicsofhawaii.com and say, I think that what happened to my mom has now happened to me. I think I need some help. Yeah.
Well, the typical symptoms, other than the obvious, again, I mean, if people have varicose veins, it's very easy for most people to say, gee, I've got a vein problem. But the typical symptoms are achiness, heaviness, fatigue, especially symptoms that, and I think this is a real key. Those types of symptoms that get worse over the course of the day.
Okay, cumulative.
Yeah. I mean, your legs feel great in the morning when you get out of bed, and then by the end of the day or the evening when you're going to bed, your legs are achy. Swelling is also another very common symptom, and that is something that's going to get worse over the course of a day.
We've talked earlier, and I'm going to talk about this in some of the frequently asked questions today. I've got a friend that when he retired, still in great shape from the military. He put in like 25 years. He was in top shape and well-trained. So he became part of a big security business. But he was an entry-level guy, so it took him a while to make the money. So what he did was he moonlighted as a guard in a couple of places. And he had to stop because it was all standing up. And he just never realized that that's what he was doing all day, every day. So that is another telltale right there, isn't it?
Well, that's another risk factor.
Yeah.
We talked about the fact that genetics are probably the number one. And usually there's genetics involved somewhere. And once the genetic sort of milieu of your body it makes it a potential for you to develop venous insufficiency, then that's where the lifestyle things come into play. And if you are someone who has worked like your mother for many, many years on their feet, then that increases your risk even more. Yeah. So the other risk factor, or a couple of risk factors are obesity. People who are a little overweight, they have a little greater tendency to develop venous insufficiency. Pregnancy, as we mentioned before, the more pregnancies a woman goes through, the more likely that she's going to have vein problems in the future.
Okay, now I want to tell you something. There's another thing too, and I've talked about this until I'm blue in the face. I know what obesity is all about as well. And so I certainly can appreciate when somebody has an addiction or an affliction, because until you deal with that, which thankfully in my life I did close now to 20 years ago, it still makes me sympathize with a lot of people. So I'm guessing, Dr. Juliet, that a lot of folks that come in, you can almost tell by the way they look what's caused them to come in the door. And I think that that's what I'm trying to do. I'm trying to make people understand this. So I'm wondering what about when to do something? You have the condition that's been going on for a long time. This question says, you should see a doctor immediately about varicose veins if, and there's a few points. What are some of those points? And is it because something that maybe used to go away when you elevated your feet at night doesn't?
Yeah.
I mean, whatever you're doing to treat it's not helping anymore.
Right. I think, getting back to some of the symptoms that people don't necessarily associate with venous insufficiency, those are the hard ones. Those are the symptoms that people tend to ignore because they think they're getting old or whatever. But swelling, achiness.
I was going to say that swelling's a big one, isn't it?
It is, swelling, achiness, leg cramps at night. That's a huge symptom, especially with our older patients. And who knows that leg cramps can be associated with vein disease as something that we can correct, and the leg cramps go away. And again, especially with the older patients that we have, getting up in the middle of the night 2-3 times because of leg cramps, it really affects their quality of life.
By the way, I had one lady that told me, I think after our second show, because we talked a little bit about leg cramps, and she said that it was scary because it was so excruciating that no matter what you did, no matter what angle you took, you couldn't make it stop. And the only way to make it stop was to get up. And to get up and put pressure on it hurt more, so you just lie back down again. So this does become really problematic, doesn't it?
Sure, yeah. Another symptom that, nobody really connects with venous insufficiency is something called restless leg syndrome. And I don't know if you've ever heard that term before.
I heard of it as the shaky leg.
Yeah.
And look, if you go, I saw this at Kahala Mall the other day. There's a bunch of kids sitting around, and I noticed that 2 of them were like their legs were just nonstop, and I thought, boy, these kids they're burning some serious calories, because that's a lot of exercise. Is that part of a venous condition, or can it be?
It can be.
Wow.
Yeah, it often is. Yeah. Now, what is restless leg syndrome? Well, there's kind of a spectrum of things, but I think typically the way most people think about restless leg is that they go to bed at night, their legs are feeling uncomfortable, and they feel like they have to move their legs in order to get them more comfortable. Sometimes that it goes to the extreme of even their legs moving in the middle of the night and either waking up their spouse.
Yeah, which is not a good idea.
Or actually waking themselves up. Yeah. But that is also a very common symptom that we hear, and it can be very disruptive of 2 people's sleep that we can correct, and the quality of life just improves tremendously.
What I think is sort of interesting to me anyway is that sometimes a parent will scold you, stop shaking, you're driving me crazy. And that's because maybe they're resting on the dinner table with their arms and their legs are literally doing the whole room. So obviously that's young. What about when people say, well, you know what? Those are just growing pains. Well,
Yeah.
maybe they are growing pains until you're about 17 or 18. But in your 20s and 30s, those aren't growing pains anymore, usually, are they?
No,
Yeah.
no. Yeah. Another symptom that people tend to ignore is the hyperpigmentation that many people see with venous insufficiency, that darkish discoloration of the lower leg. And again, nobody connects that in general with a vein problem. There are 19 different other reasons why they have it. But to getting back to your other question, what are really the tip-offs that really should make you feel like you need to become or get evaluation? One of them is something that we call phlebitis.
Yeah.
Or
isn't that what they call the Richard Nixon disease? Phlebitis in his leg or something?
I think they did say that. Yeah. So what is superficial thrombophlebitis? It's usually a superficial vein or a varicose vein that suddenly becomes thrombosed. Now, people don't know that, but what they experience is that they have an area of their leg that becomes very, very tender, just overnight. Boom.
And from what I understand, not just to moving your feet around, but even to the touch.
Oh yeah. This is like a much more acute kind of situation. Becomes very tender, very painful, becomes red.
Yeah.
And it takes a while for that to go away. So what has happened is that there's just a little branch off of one of the veins, usually typically a varicose vein, suddenly becomes thrombosed, and that can create a tremendous amount of inflammation in that one specific area. So that invariably is an indication that there is underlying problems with vein function.
Does it usually mean also, depending on the severity of it, that the treatment is indicated, that it's not going to be something that can put on a pair of socks or just elevate your legs? Once it got to that point, isn't it sort of crying out for, hey, maybe let's take this one out of there. Maybe let's get rid of this.
Well, or the fact that that is associated with functional problems with many other veins in your legs too that need to be addressed. So that's one of the things that we really encourage people to come in and be evaluated for. Recently, we talked about venous stasis ulcers, ulcers of the lower leg. And certainly, if anybody has an ulcer of the lower leg, that is something that should initiate an evaluation, for a lot of different reasons.
I'm thinking in many cases that some of the symptoms are a godsend, because if you didn't react to a symptom, and if it didn't give you a symptom, it may be by the time you figure it out, just a mite late.
Right. Right. Yeah.
Okay. So when we talk about that, there are degrees of treatment, and I know that most of the treatments that you do, most of the procedures you do in your office, are very non-invasive. They're very effective, and they have been developed more recently than not. In other words, if you had venous trouble before, say 30 years ago, the treatment program that you offer is a 180 from what you used to get.
Yes. Yeah.
What is the treatment? I know there's lots of different kinds, and I know that the sclerotherapy is one of the ones on this list, frequently asked questions. Oh, yeah, I have sclerotherapy. Really? Well, what the heck is that?
Right. I mean, getting back to how we treat things today versus how it was 20 years ago. Yeah, it is 180 degrees. The procedures that we do today are not non-invasive. We would refer to them as minimally invasive.
Okay.
But they're very minimally invasive. I mean, we don't really do. We don't make any incisions anymore as such. In the past, people, when they had vein strippings, they had, fairly big incisions all over their legs. We don't have to do surgical vein stripping specifically the way we used to do it 20 years ago. Literally people, back then people were going into the hospital. They had a general anesthetic. They were in the hospital 2 or 3 days. And we don't have to do any of that anymore. People come in, they have a procedure for an hour, and we put a dressing and a stocking on their leg, and they go on with their day.
I'm thinking this is very interesting because it also matters when you're being diagnosed. I want to go back to because I know this ultrasound question comes up a lot on frequently asked questions. But once you've determined what a treatment plan is, and you can sit down with a patient, does it determine how much either pain and suffering they can endure, or how much work can be done at any one time? And is it sometimes a treatment plan based over, say, a month or a period of time? We're going to do these first, Then we're going to do these, then we're going to do these.
Sometimes we do it that way. Yeah, typically, though, we get the work done over a relatively short period of time. Depending on, but you're right, depending on how much, how many different procedures they need, we may split things up a little bit.
The reason I ask is because it seems to me that the obvious answer that this ultrasound is so good is that in the diagnosing process, it really accelerates what you can tell in my leg or a patient's leg and see it in black and white without having to go through all, certainly not like in the old days where they opened somebody up to see what was in there.
Yeah.
Jeez.
Yeah. The ultrasound diagnosis has become so high quality and specific that there really isn't too much more that we need to do in most people. Now, some people need more evaluation. But yeah, as soon as the ultrasound is done, we know what the patient has, and we can talk about what specifically needs to be done with them.
Okay, what about IB-backs? And that is that somebody comes in and has a treatment for what you located in the ultrasound, and it looks pretty good, and 3 or 4 months into it, no problem. But what about, it's like, dentists hate when you go in there with a throbbing toothache. They like to see you like once or twice a year to say, okay, let's do this and that. What do you, I already know the answer to this, but our audience needs to know. I think that the smart people say, look, this is what diagnosed me, would help the diagnosis. How often should I get one of these to see what's going on in my legs?
Follow-up is incredibly important. And that's, I think, one of the ways that we sort of, fell short 20 years ago. We didn't do proper follow-up. But because of the fact that venous insufficiency is based typically on a genetic problem, when we treat people, we are not altering their genome. Not yet.
Yeah, okay.
Maybe sometime in the future
someday,
we will, but at least we're not right now. So what we do is that we fix all of their problems that they come in with right now. But does that exclude any other problems in the future? Well, no, because they have the genetic predisposition to develop.
I got to tell you, gang, and this is where I get the Budinsky. I 100% agree that I already know that it doesn't go away. If you've got it like I've had it, you need to be monitored on a fairly regular basis just to avoid the worst again. For instance, I've had one incredibly bad ulcer, but no more. And maybe that's because I got lucky. The trauma from the see, what happened to me in this ulcer we talked about on the ulcer show is I had a puncture, massive one, from a piece of metal girder going into my leg, 20-something stitches to close it. It didn't heal. And it just so happened to be, lucky me, that there was a vein issue right behind it. And when the two met and shook hands, they said, okay, nice hole, and I think I'll keep it. That's sort of what happened to me. But thinking that, okay, I'm predisposed for this.
Right.
The trauma accelerated it. But now I am obviously more careful. This is what's important, right? Follow-up.
Right. Yeah, the trauma brought it to light. The fact that you had that trauma and it didn't heal properly. As a matter of fact, with time, it got worse and worse. That was the indication that there was something more going on than just that you cut yourself. But even in much lesser dramatic scenarios, people that come in with routine venous insufficiency and varicose veins, they also need to be followed up. Essentially, everybody does, and that's what we do. After we treat them, we do a couple of what we call surveillance ultrasounds over the course of the first year. Thereafter, we encourage people. We try to get them to come back about every year to have an ultrasound, just to make sure that what we've done is status quo. Make sure that there's nothing new coming up, no new problems, and if there are new issues, then addressing them early as opposed to later.
Okay, here's another takeaway, my friends. One of the things that I've learned, and Dr. Juleff will explain this, and you can also go to veinclinicsofhawaii.com and find your way to this question as well, and that is, do the issues with the veins recur? And I learned when we first began, not with that vein, because we took that vein out. We closed that vein. But there's maybe a vein an inch on the other side of it that is now experiencing what. So you can't blame the treatment on a vein that's gone for coming back. They don't come back.
No. Well, the procedures that we have today have a very, very, very high success rate, long-term success rate. And, basically the procedure that we do today, as opposed to the procedure that we used to do 20 years ago, which was vein stripping, we, in a minimally invasive sort of fashion, close that vein because it's not working anymore. So we close it down. We take it out. We exclude it as a problem.
I love this question, though, because this begs the answer. Okay, how many times can I do that? I know that people are like to say, what's the bank account? How many veins do I have? And, if you take a whole bunch of them away, am I now going to have poor circulation because I don't have enough veins?
The answer to that is you can have it done as many times as you need it. Mm-hmm.
That's the answer.
If a vein is failing in its function, then it's not doing you any favors. It's working against you. Mm-hmm. So, now, can we close absolutely every vein in your leg? No, we
Probably
can't.
Not.
But of the veins that we are able to safely treat and close and sort of exclude as a problem, as many as we need to.
You often run into this. One of the most frequently asked questions. I probably should have asked it up front. I already know. And if you've been listening to the program, Vein Clinics of Hawaii does a lot of things. Some of these are just cosmetic, make you look and feel good. And you got to go to the website, veinclinicsofhawaii.com and take a look at some of this. It's because doctor's office is open. There's lots of things that you can do, some of which is what's called an elective procedure. And if you file out for an insurance claim, they're going to think that you're doing a stand-up comedy routine in their office. You're not going to get paid. But that's something that comes out early in the piece. So basically, when somebody has varicose veins that have been, looked at with ultrasound, do they have insurance for that? Typical insurance policies.
Yeah, I mean, for most insurance companies as well as Medicare cover all of that because
it's a threatening thing sooner or later, right? If you don't treat it.
Yeah, varicose veins and venous insufficiency is considered a medical problem. It is not a cosmetic issue. No. Now, spider veins, as we mentioned before, sometimes they are, sometimes they aren't, but we figure that out.
Well, and also I think the more legitimate practitioner you go to a pro like Dr. Julep and the Vein Clinics of Hawaii, the relationships you have with the insurance carriers are key because you write, on my behalf, I come in order for me to get procedure and get treatment. Aren't some patients want to know, hey, doc, I really want to do this, but I don't know if I can afford it. Am I covered?
Yeah, we do all the paperwork for people, so we make it very, very easy, and we are also very upfront. Most insurance policies are going to have some amount of out of pocket that people have to pay. Unfortunately, there's usually a deductible that may or may not have been met. So we are always very, very open to trying to define all those numbers before we do the treatment, so that people are completely informed.
Well, some people say, okay. This is a lot going on with me. Some of this is threatening could get a lot worse. Does it make sense to do, in some cases, maybe what you can afford to do? I mean, I would think yes. If I had an issue and I'd say, okay, I got an ulcer, and my insurance better cover this because it's a big old problem. But after that, maybe if I want to go in 3-4 times a year to say hi to the nice ultrasound guy or gal, that's not, But is that treatment? Is the ultrasound examination when somebody is exhibiting or presenting with a symptom part of the diagnosis, part of the treatment?
Yeah, well, yes, it is, and it is covered. Luckily, the insurance companies cover the process of evaluation and treatment for venous insufficiency pretty well. Yeah. So it is very, very rare that we would have to say, gee, your insurance company isn't going to cover this, so we have to cut corners. We certainly never get to the point where we have to cut corners. We in one way or another we treat the patient completely.
I'm thinking that there are more progressive thinkers, and sooner or later this whole insurance thing's going to get unwound because we sometimes are treating people by not covering them and covering them in areas where they probably don't need as much coverage, and I guess. Just like anybody else, an insurance company is trying to make money. But by the same token, can't you show that by treatment of these conditions are going to lessen what the treatment for the worst when it accelerates to the next stage?
Absolutely.
Of the 6 stages that we sometimes talk about. Right?
Sure, yeah, and that's another good question, and I'm sure that's another a balance that the insurance companies think about all the time. I mean, they have all the numbers, and they know that if the patient isn't treated at an earlier stage, then they're going to wait until a later stage when it's going to cost them a lot more to get them treated fully.
Okay, I'm also going to go back to another frequently asked question, and that is regarding pain. As we talked earlier, different people manifest different things. Some burning, heaviness, dullness, tingling, itching, all for the same condition. But isn't, in many respects, what's going on in our little bodies a pretty good thing when the pain bell goes off, no matter what it is? Mm-hmm. Because if you do react to that, I mean, how many nights sleep do you want to lose, right?
Right,
or how much pain and thumping and throbbing do you want to put up with?
Yeah, and if there's something abnormal going on in your body, legs included, there's probably something that needs to be evaluated, and there's probably something that can be improved upon. Yeah,
let's go back, if you don't mind. I think that a lot of people that have either seen this or experienced that shaky leg, or what you call it, restless leg syndrome, what would the indicated treatment would be? I mean, what would you look for to see what can we go in and relieve so that this either lessens or goes away?
Well, restless leg syndrome is one of the many symptoms, just like varicose veins and swelling and skin discoloration. It's just one of the myriad of symptoms that are related to or caused by this process of venous insufficiency.
Okay.
So now, is restless leg always a symptom of venous insufficiency? No, there's a percentage that are not. But there's a pretty good percentage of people with restless leg that have it because they have venous insufficiency. So those people get evaluated just like everybody else. We evaluate people that come in with a primary complaint of restless leg the same way that we evaluate people that come in with a primary complaint of varicose veins.
But do they get to a point where they have this? Do a lot of people not know they have that?
Restless leg?
Yeah. I mean, or maybe they don't certainly pay as much attention to it as a spouse or a parent would.
Yeah, they might need their spouse to tell them they have restless leg, and their spouse may be the one telling them to come in and see us.
Yeah. And when I say that, what treatments would be indicated? I mean, obviously, if that's one of the things, are there also more symptoms?
More symptoms of restless leg?
Yeah, I mean, if my leg is restless, we know that.
Yeah,
that's a symptom.
That's one symptom.
Yeah.
So, again, we evaluate, since there's a pretty good percentage of people with restless leg, that the cause of that is venous insufficiency, then we evaluate them for venous insufficiency. So if we see on the ultrasound that the major veins in the legs have this reflux, blood going in the wrong direction because of this valvular failure, then we treat them in a similar fashion that we would treat, again, somebody with varicose veins or somebody with swelling, etc.
What happens if a parent takes a child to their pediatrician because they are concerned? I was joking earlier when we first started talking about that by saying that, that's a lot of calories, and it is. I mean, I don't, and I'm thinking back in my life, I don't know any big people. I don't remember any big people that had shaky leg syndrome, but I see a lot of kids especially. So I'm wondering is that also a symptom of something else besides venous insufficiency?
Yeah, well, in kids, it's something different completely. Yeah. That's when you see kids that are we have shaky legs like that. That's strictly speaking not what we would call restless legs.
Yeah, one mother that talked to me about this a long time ago said that her son got that whenever he got around girls because they made him nervous.
Yeah.
And he used to try to hide it by shaking the leg.
Right. Yeah. Yeah, that sort of activity is, I think, just nervous energy. It's not necessarily restless leg.
However, one thing let's return to, because I think that everybody at some sooner or later says, "Oh, I got this awful cramp in my leg. I'll go get some potassium." Or I'll eat a tree full of bananas.
Right.
I mean, we try all of these weird things, right?
Yeah.
And isn't that, I want to go back to that because I would guess, gang, that a lot of you out there, men and women, have that issue where you turn in bed maybe to get a little more comfortable and you point your toes out and all of a sudden you get a leg cramp or you get this incredible pain and no matter what you do, you can't get rid of it.
Mm-hmm. Right.
I'd almost want to call you at 3 a.m. and say, "Doc, my leg's killing me. What am I going to do?"
Yeah.
What can you do? Anything?
What can
Wait
you,
it out.
What can you do immediately?
Yeah.
Yeah. Well, there's some people feel that if you or think that if you eat some mustard,
Really?
yeah.
Okay, write that down. Dr. Juleff, Vein Clinics of Hawaii said, French's mustard by the tablespoon.
Yeah.
No, but seriously, listen.
And
I don't
there-
know who thought of that the
and-
first time, but what a thought.
There is some truth to it.
Yeah.
Also, another home remedy is pickle juice. Mm-hmm. And
Is that the saline to speed?
it's because
something in there,
it's be-
potassium maybe?
Right,
Yeah,
right.
yeah.
It's because of the electrolytes that
Yeah,
are
yeah.
in both of those things. And I think there's probably some truth to that.
Yeah.
Yes. Now, typically what the two things that I recommend people do immediately for their leg cramps is not so much potassium, although that's important, but magnesium.
Oh, okay.
So I tell everybody to
Good.
just-
What is a good source? Getting a supplement?
just go to a drugstore or wherever and get magnesium and take it as is directed on the bottle. And then maintaining very good hydration.
I was going to say, a lot of people that are on weight regimens, they think the best way to lose weight is not eat or drink anything. And I do know that I've seen skinny fat people that, somebody is so jammed up, their electrolytes are so upset that they get a heart attack. Instead of never had one when they were big, they had one when they were skinny. So isn't that, I mean, I know that depending on what practitioner you go to, and I think we have discussed this before, but you should be eating, drinking 8 glasses of water a day.
Yeah.
I don't know how many people really do that anymore.
Very few, probably. But yeah, maintaining well hydration is good for muscle spasm, muscle cramping, and correct balance of electrolytes. And again, often it's a magnesium insufficiency.
And there's another thing too, and since the doc is here, we'll ask him the question. There's a lot of people that what they'll do is they'll go through 3 or 4 or 5 sodas a day, and bad enough if they're sugary, because now you got a big problem. But even equally as bad is if they're quote non-calorie, non-sugar, because don't you get dehydrated by drinking those things?
Yeah. The soda,
The sodium, or is it the bubbles, or what the heck does that?
yeah, soda is not a good thing, no matter how you cut it.
Yeah.
And I think people limiting their soda intake is always a good thing.
Well, and there's another thing too, and maybe it would be interesting because of the things that you can do. Staying hydrated, keeping a glass of water or a bottle of water next to your bed at night. But what about all of these things now? Is that if you or anybody in your office taking a look at all these things that they're now calling vitamin water? And what is that? Is that the latest gimmick, or can you really take something in water and have it help you and quickly for pain?
I'm
Jury's out on that. I bet.
I'm fairly skeptical about all that stuff. I think it's a marketing ploy more than anything.
When we get that, now there's another thing too, and this goes to the number of people that are looking for different people to subscribe to tests. And when you take a look at what's going on television at night, and you see these commercials about all these medicines that spend the first 30 seconds telling you it's the answer to your problems, and then 60 seconds after that with all of the morbidities that you're going to go through getting it. Mm-hmm. At this point in time, are there oral medications that help in varicose veins?
Nothing that's going to help in any way, shape, or form close to the procedural stuff that we do. No, there are probably some products out there that might help with the discomfort or whatever, but since it's a mechanical problem, it really needs a mechanical kind of fix.
If somebody is going to have extensive treatment, this is one of my frequently asked questions. If they're going to have extensive treatment, what do you need to know about what they're taking before you do the procedure? For instance, what if somebody's on a really big regimen of blood thinners? Mm-hmm. It seems to me if you're doing a bunch of surgery, that's not a good thing to have.
Well, since most of the procedures that we do are very minimally invasive, typically, and depending on what they're on the blood thinner for, we can actually do most of these procedures with them just continuing the blood thinner. It's not that big of a deal.
But maybe you can explain why that is, because I've seen your equipment. I'm blown away. I mean, the vein stripping that we talked about before, which was horrifically invasive. People in the hospital for days in some cases. Talk about that really quickly, that, what makes today's implements and treatment values for you be safe to be, say, on blood thinners and have a procedure done.
Well, yeah, and I think that goes to the fact that typically all we do with respect to the invasive part is just to go through little needle puncture sites to accomplish just about everything that we need to.
Okay, wait. Let's say that I've got a vein, a varicose vein, that's an inch under my skin. Mm-hmm. And ultrasound shows you this. That means that you can go in there without cutting my leg open and opening it up and getting an inch down there with scalpels and hatchets and whatever they used to use. You can just go in there and locate that vein. Do you use the ultrasound to find it?
Yeah, one of the things that we do is called ultrasound guided sclerotherapy.
That's another frequently asked question, right? What is that?
Right. And that is exactly what you just described. We diagnose that. We diagnose that vein, that insufficient vein, with an ultrasound. But while we're preoperatively, but when we're doing the procedure, we're also using the ultrasound machine extensively to identify those things. And we identify the location of a vein that we feel needs to be closed. And we can inject them superficially just through a little tiny needle.
And by the way, the needles that used to be like as big around as a pencil, those days are over.
Yeah.
I mean, and then there's one more real fast one because we are going to run out of time. We talked about the sclerotherapy and we talked about the ultrasound, guided foam. What about lasers are so popular in a lot of things. What part of venous surgery is a laser valuable to?
The procedure that we do now that took the place of surgical vein stripping is a procedure that we call endovenous ablation.
Okay.
And in the old days we used to strip the vein right out of the leg,
Ouch.
through a bunch of incisions. And we don't do that anymore. The vein stays in, the abnormally functioning vein stays in the leg, but we close it down. Now, when we close it down, your body automatically reroutes blood that was otherwise going through that vein into surrounding normal veins and then comes back up to the heart.
Which is the miracle of your system, my friends. That's what I'm blown away.
Miracle of the body, now, the way that we do that procedure, endovenous ablation, is just through one little puncture site that we use to get into the vein. And we can thread a number of different things. The two most common things are either a laser fiber or something called a radiofrequency catheter.
Yeah, I've heard that too, radiofrequency catheter.
Yeah. Both of those are utilized to heat up the inside of the vein. When we heat up the inside of the vein, it closes down. So we're sort of cauterizing the vein from the inside, if you've ever heard that word before, cauterize. Closes the vein, and then the redirection of blood happens. So
this all sounds very painful, and guess what?
It's
minimally. I mean, that's what I'm totally blown away by this. So maybe the takeaway you should be by some of the questions that we've had Dr. Juleff answer have been helpful. But you can also address this yourself by going to veinclinicsofhawaii.com and really take a look at it. And those of you on Kauai or Maui, the Big Island, or here on Oahu, you're going to get a level of treatment that's going to just surprise you. And from what I understand it's nowhere near as daunting as it used to be. You're not walking into, Dr. J's House of Horrors. It's pretty well drilled out that it's going to be not an unpleasant procedure.
Yeah, and I think that most people are surprised at the lack of discomfort that they endure through the process. Yeah. Absolutely.
I think also another thing is a lot of people, they say, well, I can't really afford to do that because I can't lose work. I hate to tell you this, gang, but you're not going to lose any work, right?
No,
you're going to be back on the saddle immediately.
Sure.
And is that because it's not invasive anymore? The only thing that's healing is the veins it used to be?
Yeah, it's so minimally invasive that people really have no difficulty going back to most occupations. Now, we kind of if people are doing real heavy work and they're lifting, then they take a few days off. But for most people, they can go right to work.
One real quick one is I know that a lot of your patients follow you around and they'll come to an office for a procedure. How safe is it after you've had, pretty good vein surgery? Is it safe to fly?
with respect to long distance flights, we ask people to not do that for a week or two.
Yeah, that's good.
But we've got plenty of people who might be coming from another island, and a quick flight from one island to the other is not going to be substantial.
Okay, one week in one of our next coming up programs, we're going to discuss that, because we know more and more of you particularly hopefully in your bucket list years, you want to do a lot of that stuff, and sometimes traveling can be a big problem. And you're going to learn about compression stockings and some of the things you can do. But in the meantime, we're running out of time on this particular program. But if you'd like to know more about what's going on, you go to veinclinicsofhawaii.com, veinclinicsofhawaii.com, and check it out. You'll be glad you did. We'll see you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.